everyone, I'm back at 100% Optical. Today I have a fantastic company in front of me called Face Restoration. They deal with plastic surgery. They deal with making people feel happy about themselves, especially if they have certain eye conditions. They're the experts, not me, so they're going to tell you exactly what they do. Thank you for being here.
Thank you for having us. So Rachna and I work together as consultant eyelid surgeons. We do eyelid surgery, but we also look after people with dry, watery eyes and people who have aesthetic facial needs. And I think the reason we were keen to talk to you today was to tell you about how we use collaboration and teamwork to provide the best care for our patients. Because you can be the best surgeon in the world, which Rachna probably is, and still not get good results. The way you get good results is doing the right thing for the right patient at the right time. And it's not always surgery. There are other things we do.
Yeah, I mean, we're delighted to be able to speak to you because we have some really groundbreaking innovation that I think everybody in your audience is going to want to hear about. So up until now, we have been dealing with eye diseases, and we have been dealing with an eye disease that is not thought to be a disease. So dry eyes is not thought to be a disease, but actually it is a disease. It causes a lot of debilitation. And it's not just because people have dry eyes from the eye drops that they're using or it's a condition that they develop. There are so many things that we do with our lifestyle that can contribute to dry eye disease. And up until now, we've been treating with baby shampoo or lid wipes or lid hygiene or tea tree oil or various other things. We've been applying makeup. We've been working in front of our screens. And over the last few years with COVID, we've been wearing masks and blowing air all over our eyes. So it's a really significant condition that has a significant impact on wellness and aesthetic. And we got very interested in it because although we're eyelid surgeons, we're also innovators. We also, as Jonathan said, collaborators. So we work with our optometry colleagues. We work with Amy Sullivan, who you're going to meet very shortly, because she's going to tell you all about the rest of the story. So not just the surgery, not just looking after dry eyes. We're here with Luminous, and we are actually ambassadors for something called Optilight, which is the first FDA-approved light treatment for dry eye disease that treats meibomian gland dysfunction. We also have developed a product called Purifies, which is available through Positive Impact. Purifies is a hypochlorous. So if you haven't heard of hypochlorous, you need to know about hypochlorous. Hypochlorous is used in the US, has been known about for over 100 years. It's what our white blood cells make to destroy bacteria and viruses. We have actually made a product that is eye safe, that can be used with contact lenses, that can be used for people who have eyelash extensions. All of your patients that come to see you need this product to look after their microbiome. But it's also the other things that we do after surgery that Amy's going to tell you about as well.
But what's your reason for doing all this? What's your main passion for it?
The main passion is because we want to give the best outcome for our patients. We want to be able to cure a disease that so far has been incurable.
Do you find that the treatments out there so far are very temporary and short-lived?
Of course, yeah. I mean, we were putting baby shampoo that had formaldehyde on eyelashes for decades to try and treat blepharitis. Well. And they shouldn't be. Although the baby shampoos may have changed, there are lots of toxic ingredients in what we use in our eye makeup, in our cleansers, in our skincare. So yes, no, we've been up until this point not being able to adequately treat a condition. We've been using antibiotics that cause drug resistance. For the first time, we have 3 technologies that we're going to be talking about today. So we've got the Purifiers, we've got the Optilight. We're also going to be talking about some eye-safe products, which are optocosmetics.
Fantastic. Let's get started.
I mean, one of the exciting things for the people who are here today at 100% Optical is, as opticians, getting the right tear film, so getting a good stable tear film on the ocular surface is key to sharp vision. If you imagine you can get the best glasses in the world with a perfect refraction, which all our colleagues here can do, but if you cut an onion and you get more water, so you have the wrong amount of tear film or an incorrect tear film, your vision goes incredibly blurry.
Yeah.
And so treating dry eye disease, treating watery eyes, because often dry eyes present as a watering eye, because of a reflex to the dryness, then you'll have unhappy patients who will think there's something wrong with their glasses. But actually, it's not the glasses, it's the watery eyes. And I think that's why we like being here, and it's why we wanted to support Luminous, because they have actually spent a lot of time developing this wonderful machine, the Optilight, and we use it in our clinic. We've had it for a year. We were the first clinic in the UK to have the Optilight, and we've been very pleased with it. And we use it for our surgical patients before or after eyelid surgery. and it can be really helpful. So many people in England have rosacea, which is this underlying condition which often leads to the blepharitis and the dry eye.
Should have brought some onions here.
Well,
You don't want us crying.
when life gives you onions, make some sort of ratatouille. Or something. Talking about ratatouille, Amy, who's with us, is actually French, Sicilian, Bostonian.
Oh, wow.
And we met her because she's a very intelligent person who's worked extremely hard to bring this product, the Eyes of the Story, which is this eye-safe makeup. We see so many patients who come to our clinic who are unable to wear makeup because they become intolerant because there's so much inflammation in their lids. And so while we use the Purify spray and we use the Luminous Optilight machine to reduce the inflammation, if we then apply some nasty makeup, it'll just flare up again.
Yeah.
And that's where this component is so important. And so the overall take-home message from our point of view, before I hand over to Amy, is that we want the best outcomes for our patients. We are extremely good eyelid surgeons, but being a good eyelid surgeon isn't just about eyelid surgery. You've got to think bigger, and you've got to work with other team members to make sure that you bring the best from various aspects. So engineering, makeup, and surgery, and chemistry.
Well, you built it up so much. I'm looking forward to it now. No pressure.
Thank you, Jonathan. Rachna. What's really interesting about this is you said that you're eyelid surgeons. It's not just about the surgery. It's not just about the opticians, the optometrists who are fitting lenses and frames or, say, doing surgery. What we have to understand is that in between treatments or surgical procedures, the patients go home to their daily lifestyles, their choices, and our lifestyle choices can literally impact our eye health. Our beauty routines, our hygiene routines, and our anti-aging routines can impact our eye health. How? And stress, of course. And when you're stressed, you want more beauty treatments.
You mentioned TFOS.
And so what's interesting is I've been doing research on this area and working with eye care professionals in, I think, over 100 countries for about 20 years now with the Tear Film and Ocular Surface Society. We focus on front of the eye diseases. And one of the reasons why I created Eyes Are the Story, Opto Cosmetics and Skincare is because I realized there is a significant unmet need for eye-safe cosmetics. And again, cosmetics are something that you rub or sprinkle or spray on your skin. Anything that you put on your face, around, or on your eyes can actually impact your eye health, whether it be the ingredients in a product or the application. So what we've done here, and we realize that you do, say, with Luminous, with the IPL treatments, it's fantastic because the patient comes to you 4 times a year for a treatment. Okay, but what happens in between those treatments? That patient goes home and they might be using baby shampoo to clean their lids. And then they use waterproof eye makeup, and then they basically can almost sabotage the treatment that you've given them. So
just to put that in another way, the way we've kind of thought about this is it's a bit like going to the dentist. We're sort of the dentist. You come to us for a treatment, but then when you go home, you've still got to brush your teeth.
Yep.
And using the Purify spray, using the eye-safe makeup is part of that brushing your teeth equivalent. And what's really cool about Amy is that in addition to spending the last 2 decades doing all this research with all these experts in dry eye, and therefore being able to develop this, is that she has also thought outside the box and then come back to us. She heard about the Purify spray and is now incorporating the Purify spray into the regime because being eye-safe makeup is probably not enough. Again, you need a multimodal approach. And so by having the Purify spray in that treatment regimen, you're able to reduce the inflammation.
From all angles, yeah.
Exactly. And so, and that's why there are 3 of us squeezed onto this screen because we're trying to hit it from all angles.
Yeah.
And so what we want to do is we want to share with people really to clean up your act. So before you can put paint on a canvas, you need to make sure the canvas is clean.
Yeah.
Before you put any color on your face, you want to make sure that your lids are clean. So what we recommend is, say, our 3 steps to eye-safe beauty in between the IPL treatments, but just on a daily basis. We recommend you cleanse your face, you wash your face with our cleanser, but then you take the hypochlorous acid spray created by Purifies, and then you spray. It's an antimicrobial, but it's great. It can also be used as a toner. And then you moisturize because the area, the skin around your eyes is very delicate and very thin. So it's very important to use something, once again, that's eye safe. So we want everyone to clean up their act before they put on the color.
That's a good tagline.
Yeah. And it's simple. What you do before you go to work in the morning and what you do before you go to bed at night. So you need to make sure that your hygiene is eye safe.
If I can just add one more thing, I think the importance of dry eye disease can't be overstated because earlier we talked about opticians wanting to get clear vision, but it's not just that. if you have watery eyes, people will think that you're sad all the time, which means they'll approach you with sympathy and sadness, which creates a very sad environment for you. It'll blur your vision, it'll make you look sad, but it'll also irritate your skin. Having tears run down your face will make glasses not sit well on your nose. Because glasses have these pedestals here, it can lead to increased inflammation. You can get eczema where it's dripping out.
Just to prevent contact lens wear as well.
But you can't either exclude Rachna and me from it, because sometimes the watery eye is not just due to the inflammation in the lid. Sometimes it's a lid malposition or a weakness in the pump, because the tears are made all over the lids and the lacrimal gland. But then there's a muscle pump that moves that water across to the little drainage holes which are near the nose. And if that's weak, or if the lid isn't sitting in the right position, or if that hole is blocked or pointing outwards rather than inwards, you can end up still with a watery eye.
I think that's a really important point. And I think what we want to say is that actually, as you can see, collaboration is important, but we also need to look at the patient as a person, as a whole. So it's not just about treating their eyes. We have to think about conditions that can contribute to the dry eyes. We have to think about the things that we do in the lifestyles that can contribute to the dry eye disease. We have to think about the things that they do when they go home, as Amy said. That can make things better, that can make things worse. And we have to listen to our patients. We have to give them the best outcomes, and the best outcomes can only be done if we can continue to push the boundaries of innovation. And these new technologies and new products, we have actually actively sought out. So it's not that it just happens to be that we've stumbled across it. There's a missing step in our regimes that I think everybody needs to be aware of.
The collaboration obviously shows the interest in it within the optical industry and how much of a need there is for patients as well.
I think that need has increased recently because with COVID, people started spending more time at home. They spent more time staring at screens. Screen usage is up in children and in adults. And when we look at a screen, right now I'm looking at you as a person, and we are both blinking because it's a nice disarming thing to do. When we look at a screen, we blink much less. And so a lot of people found during COVID that their eyes got more dry, and therefore this need for treating the ocular surface and making sure that we have good, healthy eyes has become much more noticeable. Rachna mentioned earlier the mask, for example, gave a lot of people inflammation and blowing, leaking air. It can be very disabling. It's controlling dry eye disease, is also important for one's job. Some people with dry eye disease can't look at a screen anymore. Also, we have patients who become contact lens intolerant. With the Purify spray and the Optilight treatment and using this eye-safe makeup, we've been able to take people who are contact lens intolerant and make them contact lens tolerant again.
Amazing.
And that is a huge thing for people.
I think the main reason why you're able to do that is because of the multi-pronged approach that you're taking. The lifestyle, the actual cause, and how they can manage it in between your visits to them as well.
I think if anyone wants more information about this, the products Purify's Eyes of the Story currently in the UK are exclusively distributed by Positive Impact in the dry eye space to the optical sector. There's a huge amount of consumer awareness. So your patients, your consumers are going to be much more aware of it because as well as being consultant surgeons, we're also listed as top surgeons in the Tatler Guide, in Hello, in Editor's List, various other rags. But consumers do read these things. They want to know what is the best out there. And all of these products, Purify's, Optilight, Eyes of the Story, are written up in the Daily Telegraph, in the Daily Mail, in Mail Online, Tatler, Hello. They will come to you. They will say, I've read about this. Do you provide this? And
it's about time that we do start offering the best treatments out there rather than just the bog standard drops that we normally do.
Yeah, we need the education.
And that's the thing. We all have our education, like Amy just mentioned. But then, of course, the world moves on. And one of the challenges of being a clinician or a practitioner is keeping up to date. And this is now a well-established thing, and everyone should really be moving on. I think if you're not using Optilight or light treatment for dry eye disease, if you're not using a cleanser, and if you're still allowing people to apply traditional inflammatory makeups, which can be really nasty and full of bugs and bacteria and things like that, then you're not offering the best anymore to your patients.
I think as a practitioner, you have an obligation towards the patient that comes in to see you to give the best solution to them. And if you're not, then that's a disservice to the patient.
That's a really important point because people are going to be reading about this. They're going to say to you, why have you not heard about this? I've heard about it. I've read about it in general press. And so it's really important to give the best possible.
Well, now I hope everyone has heard about it.
Well, I was going to give a plug, actually. So if you want to read more about this, you can go to our website, which is facerestoration.com, or you can, if you want the Purify spray, you can either get it through Positive Impact or purifies.co.uk.
And one more thing, because we're actually also very honoured to be co-authors in the Cosmetics Subcommittee TFOS report that's going to come out in
Which
spring.
is Amy's big hundreds of pages
but
of report.
It's multiple authors that are international experts in dry eye disease. And this is going to be the biggest publication, I think, relating to toxic ingredients that can affect the ocular surface. So look out for that. That's going to be in peer-reviewed literature in the journal.
So this report that they referenced, the TFOS report, again, is from the Tear Film and Ocular Surface Society. It will be available for free online at tearfilm.org, and it addresses how our lifestyle choices can impact and cause ocular surface disease. And also it will address whether it be cosmetics or cosmetic surgery, nutrition, contact lens wear, digital screen time. I mean, it's really incredible. Even how we live, or air conditioning, equipment that we use, can impact.
Education is key. You wouldn't know about it.
And do you want to mention tea tree oil and the Demodex mite?
I think that we'll read about it.
We'll read about it in the peer review.
Yes, exactly.
Please do share it when it comes out.
There is a lot of
We'll be happy to look into that.
soon, and again, it will be available for free. But it's all about
Fantastic.
teamwork, and it's all about collaboration, because we learn from each other
Yeah.
the unmet needs, how we can address them,
Yep.
and how we can move forward and innovate.
Fantastic. Great. Thank you very much, guys. Thanks for your time. Thank you.